Hello everyone, good morning. Welcome back to our channel CPC ADDA. In our last video, we have seen what is anesthesia, what is the types of anesthesia, anesthesia included services, and what are the services not included in the anesthesia. And we have seen important modifiers like 23 and 47 and how to report anesthesia timing as well. Right? In this video, we will cover the physical status modifiers. Okay, physical status modifiers, right? So these modifiers provide crucial information about the patient's condition and significantly impact reimbursement. So let's see. So let's start with the basics. What are physical status modifiers? Physical status modifiers labeled as P1 to P6, right? Labeled as P1 to P6 are used to describe patient's medical condition prior to undergoing anesthesia. These modifiers are critical because they directly influence complexity of anesthesia service, level of care required from anesthesiologist, and reimbursement, right? So these are important because they directly influence complexity of anesthesia service, level of care required from anesthesiologist, and reimbursement rates, right? So what are physical status modifiers? Physical status modifiers used to describe a patient's medical condition prior to undergoing anesthesia. In other words, at the time of administering anesthesia, what is the physical status of patient, right? At the time of administering anesthesia, what is the physical status of anesthesia? So we have 6 physical status modifiers, right? 6: P1, P2, P3, P4, P5 and P6. Okay, these 6 physical status modifiers we are having, which is used in anesthesia, right? So all these 6 physical status modifiers we have to use with only 0 series codes, right? We have to use only with 0 series codes, that are anesthesia codes, and you should not use these modifiers with any other type of codes. You have to use only 0 series, right? So in exam, if you find these modifiers with any other type of equations, other type of series, if you found this, then directly you can select that as a wrong answer, right? So let's see what are the physical status modifiers we are having. One by one we'll see. So now let's discuss about each physical status modifiers in detail, right? So these are the physical status modifiers just now we saw. What is P1? P1 is normal healthy patient, and P2 is patient with mild systemic disease, P3 patient with severe systemic disease, P4 severe systemic disease, constant threat to life, and P5 moribund patient not expected to survive without operation, and P6 brain dead patient, organs for donor purposes. Okay, so what is P1? P1 is a normal healthy patient. So this applies to patient with no systemic disease or abnormal conditions. No systemic disease. Okay, there is no systemic disease. For example, if you see a 25-year-old undergoing a routine appendectomy with no prior health issues, so we can see this as a normal healthy patient. So in this case we can append P1 modifier with anesthesia code, right, to represent this patient is normal healthy patient. This physical status is normal healthy patient, right? So what is P1? A normal healthy patient. So this applies to patients with no systemic disease or abnormal conditions. So next see P2. What is P2? A patient with mild systemic disease. mild systemic disease. When we can say mild systemic disease? If that condition is under control. Okay, if it is that condition is under control, then we can say it is mild systemic disease. Okay, so this modifier used when the patient has a controlled condition that doesn't limit their daily activities. Okay, that is not affecting that patient's daily activities, then we can say that is mild systemic disease. Okay, for example, patient having well managed hypertension, or if patient having controlled diabetes, right? Controlled diabetes, controlled diabetes, or well managed hypertension, diabetes. So when it is under control or well managed, then we can say it is mild systemic disease. If patient having mild systemic disease at the time of administering anesthesia, then we have to use modifier P2 with that anesthesia code to represent that patient having mild systemic disease. Okay, so let's see modifier P3. What is P3? Patient with severe systemic disease. In P2 we have mild systemic disease, in P3 you have severe systemic disease, right? Patient having severe systemic disease, and that is not threat to life. Okay, this P3 modifier assigned when the condition limits daily activities but isn't life threatening. Okay, in P2 you see mild systemic disease that is not limiting their daily activities, but in P3 if you see, it is a severe systemic disease and it is limiting their daily activities, and it is not threat to life. So this situation is severe systemic disease but not threatening to life. So in this case we can use modifier P3. For example, if patient having uncontrolled diabetes or uncontrolled hypertension, say in P2 we see controlled diabetes mellitus or well managed hypertension, but here in P3 uncontrolled diabetes mellitus or uncontrolled hypertension or poorly managed hypertension, we can say those conditions are severe systemic disease, but those conditions not threat to life, right? Or if you have chronic obstructive pulmonary disease also, COPD also example for severe systemic disease with no threat to life. So in these conditions we will use modifier P3 to represent patient having severe systemic disease at the time of administering anesthesia. And let's see P4. P4 is severe systemic disease, constant threat to life. See, P3 also severe systemic disease but no threat to life, but P4 also severe systemic disease but constant threat to life. Okay, so for examples, if patient having any unstable angina or advanced heart failure, okay, these conditions considered as severe systemic disease with constant threat to life. Okay, this reflects a critical condition that could deteriorate during surgery, right? A patient with unstable angina or advanced heart failure, we can consider that as a severe systemic disease with constant threat to life. Okay, and next see P5. P5 is moribund patient not expected to survive without operation. Okay, moribund patient not expected to survive without the operation. So in this case patient condition is very critical, and if you leave that patient without doing any treatment, patient definitely will expire. But if you do the operation, if you do the surgery, there is a possibility of survive, right? That is the moribund patient. What is moribund patient? It is a condition, if you do the operation, there is a possibility of survive. If you not did anything, if you not do anything, if you leave as it is, patient definitely will expire. Okay, for patients in critical condition where surgery is the only option to prolong their life, so that is called moribund patient. So for example, a trauma patient with massive internal bleeding, a trauma patient with massive internal bleeding. So if patient having massive internal bleeding, if you leave that patient as it is, definitely he will expire. At least if you do surgery, there is a chance of survive, right? And next, P6. What is P6? Brain dead patient, organs for donor purposes. Okay, patient is a declared brain dead patient whose organs are being removed for donor purposes. This is a specific to organ donation cases. For example, a brain dead patient undergoing organ harvest surgery for transplantation. Okay, brain dead patient. If you notice brain dead patient, then directly assign modifier P6. Okay, these are the modifiers. Physical status modifiers. What is physical status? At the time of administering anesthesia, what is the condition of the patient? What is the physical status of the patient? So based on the condition of the patient, we have 6 different types of modifiers: P1, P2, P3, P4, P5, P6. These are alphanumeric modifiers, starts with P and numeric, right? P1, P2, P3, P4, P5, P6. So what is P1? Normal healthy patient. P2, patient with mild systemic disease. P3, patient with severe systemic disease but no threat to life. P4, severe systemic disease but constant threat to life. P5, moribund patient, and that person not expected to survive without the operation. Okay, P6, brain dead patient. Okay, so now that we understand the modifiers, right? So let's discuss their impact on reimbursement. So each modifier represents an increasing level of complexity which justifies higher payment rates. For instance, P1 requires minimal monitoring because P1 modifier using for normal healthy patient. If you see P1 modifier added for anesthesia code, then that patient is a normal healthy patient, right? Then you require minimal monitoring for that case. So whereas P6, moribund patient, P5 where is moribund patient, here patient already having a condition, without surgery there is no chances of surviving. If you do surgery, then there is a chance of surviving, right? So in this case you need intensive care and resources, right? So compared to P1, P5 require more attention, intensive care and resources you required. So for P1 to P5, say compared to P1, P5 require more attention, so more money also. Okay, more money also have to pay for this modifier, right? So directly they are impacting on reimbursement part, right? If you, so based on the documentation, you always choose the correct modifier because they directly impact the payment, right? So always ensure the patient's preoperative status is thoroughly documented by the provider. The coder cannot assume or assign a physical status modifiers without proper evidence. Okay, let's see some real world examples. Okay, so for example, a 40-year patient. Okay, 40-year-old patient with advanced 40-year patient with controlled asthma, undergoing gallbladder removal. So okay, undergoing gallbladder removal. So here what physical status modifier you can utilize? That is P2, because it is a mild systemic disease, right? Controlled, you see, it is under control, so you can give as mild systemic disease, modifier P2, right? So in second example, you see 60-year-old patient with advanced heart failure requiring emergency surgery for ruptured aortic aneurysm. Okay, ruptured aortic aneurysm. Patient having advanced heart failure requiring emergency surgery for ruptured aortic aneurysm. So advanced heart failure is severe systemic disease with constant threat to life, right? Constant threat to life. So which physical status modifier? P4 have to use, right? It is a life threatening systemic disease, right? So P4 have to use. So in another example, you see a brain dead patient, what I told already, if you notice brain dead, then directly you have to assign modifier P6. Brain dead patient undergoing organ harvesting for transplantation. So modifier P6 you have to use. Okay. So you can see some other examples as well. For example, patient having controlled hypertension. What it will be? Controlled hypertension. So when I say it is controlled, then it is under control modifier P2, right? Normal healthy patient modifier P1. So if it is mild systemic disease, it is modifier P2. If it is life threatening condition is P4, that is constant threat to life. If say some acute organ failures also we can say constant threat to life. So if patient having acute organ failure also, you can use modifier P4. Okay. Brain dead patient we already saw P6 for brain dead patient P6. Okay. So in this video we have discussed about physical status modifiers P1, P2, P3, P4, P5, P6 and their use in different situations, right? So if you found this video helpful, make sure to like, share and subscribe for CPC ADDA. Let us know if the comments if you have any questions or topics you would like to cover next. Okay, in our next video we'll see about qualifying circumstances and remaining topics on anesthesia, moderate sedation and some important modifiers used in anesthesia. Okay, thank you, bye bye.